Some of the myth, if they do IVF, is 100%. It's not, right? So age then comes into the matter, and sometimes you go, doctors trying to push me for IVF. No, we look at your age, right? We know this is the things that we experience statistically and also on a day-to-day basis. We do struggle when the wife's age is much more older.
So maybe you could break down to us the difference between IUI, intrauterine insemination, and also in vitro fertilization. Just by the name, of course, you know what is the difference between those two. But which group of patients maybe they can try with IUI, some of them with IVF, and what would be the success rate between these two?
Right, so IUI basically stands for intrauterine insemination, and IVF is in vitro fertilization. So the fertilization occurs outside for IVF, and the fertilization occurs inside for IUI. So IUI is super simple. Basically, we will put the female partner or the wife on some medications, fertility tablets, just to make the eggs a little bit, 1 or 2 enough.
Okay.
And then we then monitor the follicles, and once it gets to a certain size where the egg is mature, and usually this falls anytime between day 11 to day 15 of the cycle, means she's ready for the process. And we give 1 injection to basically make the egg ovulate or rupture, and it's fertile time, and the husband on that day would then come to the lab or the fertility center or bring it from home, and we'll just inseminate processed sperm, which means we basically take the best swimming sperm or the fastest moving sperm so that we get the best pregnancy rate inside the uterus. Now, how we put it is just a very small, fine plastic catheter, put it through the vagina, through the cervix, feels like a pap smear or less painful. Okay, so it's really super simple. Then you will wait for 2 weeks whether your period comes or not. If your period does not come, possibility you may be pregnant. Okay, and we have very simple tablets after the IUI. Super simple. You can continue your activity as usual. Pregnancy rate unfortunately is about 10 to 15% for each cycle. For the younger ones, cost maybe roughly about 2,000 to 3,000, depending on how much hormones you're using and which setting you are doing. Now for IVF, it's different. It's much more strenuous. You're going to start on your 2nd day or 3rd day of your period. Depends on the protocol, but majority of the time, 2nd day or 3rd day of your period, and then you'll be injected. Okay, injected daily. I'm sure you've been through it, right? The majority will be injected daily for at least a good 10 to 12 days with scanning maybe 2 to 3 times in between. And on the day, usually again mid-cycle, anytime between day 12 to day 16 of the period, you will be ready for an egg pickup. It's all done as a daycare procedure, nothing at the tummy. You will be asleep, right? A light sleep. So you won't have any pain, and will be then the needle will go through your vagina, nothing to the tummy, you're asleep, half an hour procedure, you go home at lunchtime, most of the time. So no need to stay overnight in hospital. Then we do the fertilization in the embryologist in the IVF lab, and usually we'll wait at least 5 to 7 days to see how many total of fertilized egg, or what we call embryo, that we are able to vitrify, or what we're able to freeze and utilize, right? So then, after that, usually it's going to be either a fresh or frozen embryo transfer. Now, fresh means anytime between 3 days or 5 days after the egg pickup, you will have a transfer. Procedure, similar like an IUI, similar like a pap smear, usually I say. Super simple, no sedation. You'll be fine, right? You don't need the sedation, right? And then after that, you will wait, and you'll be giving some medication. Some is oral form, some are vaginal suppository, some may require injections. Okay, so you will then do that for maybe 10 to 12 days. Do a urine pregnancy test or a blood test. Okay, so then you will know, whether you have conceived or you have not conceived. Now, pregnancy rate depends on the age of the female. 30 to 39 years old, we are looking at 40 to 50% pregnancy rate. But overall, if you see, it's 30 to 40. In a good lab, in a good center, we're looking at 40 to 50%. Between 30 to 39 years old of the female partner, it will drop. At 40 years old, we drop to 27%, and drop much, much faster. Statistically, more than 45, your pregnancy rate would be less than 1%. Okay, so that's something that we need to always tell the patient. some of the myth, if they do IVF, is 100%. It's not, right? So age then comes into the matter, and sometimes you go, doctors trying to push me for IVF. No, we're looking at your age, right? We know this is the things that we experience statistically and also on a day-to-day basis. We do struggle when the wife's age is much more older.